I'm a simulationist. It used to take me weeks to create a simulation. Now I can put in my concept ideas, what I'm looking for, and have a simulation in less than a minute.
The future of nursing education is here, and it's powered by AI. Dr. Kellie Bryant joins me as we unpack how AI is reshaping classrooms, simulations, and clinical prep, and what educators need to know to keep up. Welcome to the Lippincott Spark, Illuminating Nursing Education podcast. I'm Dr. Kellie Dries. Join us as we ignite your passion for nursing education and leadership. We'll explore the latest trends, hear from expert nurses, and provide tools to keep you inspired. Let's dive into today's episode and continue your professional development journey together. Artificial intelligence is transforming how we teach and learn, especially in nursing. Did you know AI-powered simulations can now replicate complex clinical scenarios with remarkable realism? It helps students sharpen their clinical judgment, communication, and decision-making skills. In this episode, we explore the evolving role of AI in nursing education and how it's reshaping both clinical and classroom learning. From immersive simulations and ethical considerations, we'll unpack the promise, pitfalls, and possibilities of AI. If you enjoy this conversation, be sure to subscribe, share it with your colleagues, and check out our resources for more tech-enhanced teaching. Joining us today is Dr. Kellie Bryant, Director of the Center for Innovation in Education Excellence at the National League for Nursing. With over 20 years of teaching experience and deep expertise in simulation, Dr. Bryant brings a wealth of knowledge on how technology can enhance nursing education. She's also a consultant for advancing health equity and a nationally recognized speaker and author in the field. Welcome, Kellie.
Thank you so much.
Let's get started by exploring the big picture of AI in nursing education. How might AI enhance and reshape the educational landscape for nursing students and faculty?
AI is really transforming and changing nursing education. So I'll start with the students. On the student side, students are probably using it more than we are. I have done presentations where students have come up to me and told me some of the creative ways that they're using AI and how it's helping their education. Students are taking our lectures, our PowerPoints, and putting it into programs like Notebook LM and creating these creative, very innovative podcasts. If there's a difficult concept that they didn't grasp during the lecture, they're putting it into generative AI and telling it to break it down and explain it to them in simpler terms. And the one way that students are using it that I love is they're creating their own test questions. And they're using that as a way of studying, preparing for their tests. And I can tell you, I've heard firsthand testimonials where students have actually gotten better grades. And when asked, the reason why was because they started generating test questions, practice questions using AI, and it has significantly improved their test grades. So students got it. They're using it.
That's fantastic. Yeah.
Yes. So on the faculty side, it's also very helpful for us also. I'm a simulationist. It used to take me weeks to create a simulation. Now I can put in my concept ideas, what I'm looking for, and have a simulation in less than a minute. Now, I'm not saying it's perfect. I can tweak it, change it, make it my own, but it gives me that foundation so that now it's much easier for me to edit something than to create it from scratch. It can help with creating assignments. It can help with grading. It can help you with creating your lesson plan, test questions, to actually creating PowerPoint presentations. So the use of AI is unlimited. And that's just the teaching side. Then you have the administrative side where it can help you with all those boring and, creating policies or track students.
I was talking to an administrator and they said, all of the recommendation letters I have to write, even you look at accreditation when you're writing your self-study and looking at the evidence to support the standards, et cetera. Is my self-study really articulating the good work that the team is doing? So yeah, limitless possibilities.
You think of it, try it. That's the biggest thing that I say, and be careful now. We'll talk about the pitfalls. You can't put everything open ChatGPT or open AI systems, but just see how it does. Like you said, create reports, analyzing data. it can be done so quickly with AI.
Yeah. And faculty wish, geez, I wish I had an assistant. Well, you have an assistant now, right? So a little administrative assistant to help you extend your arm, and same with administrators as well. So now let's shift to some of the concerns, right? And that come with these innovations. What overarching concerns should nursing faculty administrators kind of keep in mind as AI tools become more prevalent in nursing education?
I would say the number one thing that we need to be cautious and aware of is that AI is not perfect. It can produce a wonderful, beautiful, looks great output and be completely wrong or inaccurate. So one of the biggest lessons that I tell people is don't trust everything that comes out of AI. It's only as good as the data that it's pulling from. So if that data set has flaws and bias embedded in it, that's going to come out in those outputs. So it's up to us, whether you're a student, whether you're a faculty, whoever, you need to take that output, and I would say with a grain of salt, but really use your skills, your knowledge, your critical appraisal skills to figure out, is this in fact actual? Can I use this information? Is it true? So that piece is not removed. And a lot of times it is accurate, but there have definitely been times where I have questioned things or I've clicked on the source and realized that source does not exist.
Sure. The hallucinations, right? Yeah.
And then the other piece that I think people forget, we get so excited about using generative AI that we start putting everything in it. And just being aware that, if you're using open source generative AI systems like ChatGPT, you can't put everything in there. You still need to protect students' data. You can't put their name information. Let's say you want to have it analyze some research that you're working on. You don't want to put certain things because that's going out into the public domain. So just being aware of what you're putting out there, unless you have a closed system where you know that it's staying within your system, and that's a different story. So just knowing what it is, knowing the capabilities, but also knowing the limitations and things that you need to be cautious about.
You said it's as good as the information, kind of garbage in, garbage out. It's also about the prompt, right? I've used it and I thought, well, no, that's not what I was looking for. But then I look back at my prompt. Was I specific enough? Did I have some of those key pieces in there to be able to get the response or the information I'm looking for?
Well, I have a beautiful solution to that. So yes, prompt designing, prompt engineering is a science in itself. But you know what you can do? Any prompt that you put in, just put it in and end it with, before answering, please ask me any clarifying questions. And I'm telling you, that one line will improve your prompt. So it will actually tell you, what about this? You're missing this. What's your audience? So it will help you to create a beautiful prompt. Add that sentence, and I tell you, you will get a much better output.
Sometimes I play the stump the AI assistant, where I think I write a beautiful email. I think it is on point. It's professional. We got this. And I just put it in AI and say, could you analyze this, rewrite this to make sure that it's professional, engaging, appreciative, whatever. And it comes back with something beautiful. I mean, really changed up the words, and they said, here, you hit this, you hit the mark on these things, but maybe here's a more polished sentence you can, consider. And I thought, wow, so I'm actually using it to grow in my writing skills.
That's probably the number one prompt that I use. Revise, and I cut and paste whatever I create, email or, report, and it makes it sound beautiful.
Yeah.
So yes.
Yeah, absolutely. Great insights. So looking ahead, let's talk a little bit about the future. What do you see as the biggest opportunities and challenges, of course, in integrating AI into nursing education over the next decade?
The greatest opportunity, and I'll make it even broader in healthcare, is that AI, like I said, is here to stay, and it's going to enhance everything from education to patient safety when it comes to the clinical setting. And I think it's going to save us a whole lot of time. Some of those tasks that we don't love to do, and it's going to allow us to spend more time, whether we're a nurse in the hospital, more time with the patients, administering patient care versus charting. If we're an educator, it's going to allow us more time, to do those scholarly activities and some of those other things that are part of our role as faculty. There's so many opportunities also for AI systems to create personalized learning pathways for students. So being able to analyze students' performance and saying, here are the areas you're strong, here are the areas that you need a little bit more, practice. And here's what you can do to kind of fill in those gaps. Here's the readings you can do, here's the skills you need to practice. So I love the fact that it can give students that kind of personalized pathway to success. I think it also can be used to identify students that might need a little bit more resources, so identifying that early on so that we'll have less students who are not successful in nursing school or whatever profession. And then again, not just being able to identify it, but having a plan to help the students meet those gaps that they're demonstrating in their performance. Some of the challenges and limitations is resistance is one of them. Sometimes as educators, we're like, if it ain't broke, leave it alone. And so getting some people to think differently and to be innovative and give it a try, I think is the biggest challenge. And a lot of that comes from, I don't know what it is. So until I understand it a little bit more, I'm not going to use it. I don't trust it.
Yeah.
And rightfully so. Like we just gave some examples where, it's not always correct and right. So I think we need to have more educational resources for faculty, for students on how to use it responsibly. What are the best practices for using AI? Because we need to incorporate it into our teaching. There's no more these days where you can just ask a simple question. They're going to use AI to come up with the answer. And so the fear is that we're going to lose those critical thinking skills because we're just going to put everything in AI. Finding ways to actually incorporate the use of AI into some of our lesson plans and some of our assessments. Having the money to invest in AI is going to be important, and having an interdisciplinary team that's going to help with everything from figuring out what systems we need, how to implement it, and most importantly, how do we evaluate to make sure this is in fact enhancing education? So how are we measuring that? And then where do we need to tweak it? How do we sustain it? How do we grow? So it's necessary to have those champions on board that are going to not just get it started, but to be there for the long haul.
Mm-hmm. Are you seeing AI committees or work groups, or like you mentioned, champions? What are you seeing in nursing education related to that? I was just curious.
It's the whole gamut. I've heard about universities that are like anti, AI, like don't even use it, don't think about it, which I don't necessarily agree with because we need to use it. And then I just came back from doing a presentation in Wyoming where this school has a whole interdisciplinary committee, AI work group, that's working together to find ways to incorporate it into across the college. So that's wonderful. And having those champions is so, so important. And then there are hospital settings that, again, have groups within the hospital that are testing out, AI software programs, devices, teaching people how to implement it into their workflows, people that are doing research in AI platforms. So it's best if you have a team of people, you have a plan, you have policies and guardrails in place. That's the hard part. No one has the answer that everybody can just take and use at their institution. It has to be, individualized for the institution. But having that in place is very helpful. And again, having that team of people that are kind of overseeing it and make sure that it stays at the forefront.
You'll hear faculty say, well, if my students use it, that's cheating. They're cheating. They don't know what they're doing. Again, back to that critical thinking, it's usurping that. When I was working with one of the faculty a few months back, she said, you know what, I'm not sure what to do. We need a policy, and where do you even begin? And do you have counterparts at other schools? Are they doing, looking at some best practices, look in the literature? And she said, well, I'm just going to ask AI to come up with an AI policy. And I said, well, that's a start too.
There you go.
I don't know, something to work off of, I guess.
And there's one I forgot to mention. There's a school that actually has set in their curriculum that all students have to take a course in AI.
Oh, okay.
So, there's, like I said, there's extremes of don't use it to, we're going to make sure when you graduate, everybody has at least these AI literacy and competencies before they graduate. And I think that's more so the way that we should be looking at AI.
Let's now bring it to kind of the ground level. Can you share maybe a couple examples of how you've seen AI, successfully integrated into a nursing curriculum, or even you mentioned simulation experience. I know you're, have vast knowledge in simulation. What impact has it had on student learning?
So I'm not in the academic setting anymore, so I can just kind of go by hearsay from presenting and hearing faculty stories. So long-term effects, I don't think we know yet because we haven't. AI is still new. We're still
Yeah.
trying to figure it all out. So I think we need more research to figure out what are the long-term positive or just effects in general of using AI and what are the best practices. So all I can tell you is anecdotally, faculty have been using it, like we said, from everything from curriculum development to looking at some of their data and metrics and figuring out what areas do they need to improve upon, using it for accreditation. Faculty have been using it just to improve their teaching, taking their presentations, their course syllabi, and having AI evaluate it and give them recommendations on how to improve it. To faculty using it to create test questions. Those are some of the more common ways that I see people using it. In the simulation world, like I said before, creating scenarios, and not just scenarios. If we are deciding to use simulated participants or SPs, creating scripts for them, creating rubrics so we can evaluate the students, to creating those simulation assignments, you name it. AI most likely can assist with it. And the other big piece too is, sometimes we have students take these standardized exams, whether it's Kaplan or ATI or all these things. And, you get those results at the end and then we don't know what to do with it. So being able to take your class and aggregate that data to really identify again, what are my students getting? They're great at
Yep,
this,
we
but
see
they're
that
all
at
missing this
with our
point. So maybe I
Lippincott
need to go back
exams.
and
Yeah, absolutely. You see it, but you want to have that. You mentioned that individualized approach for that student, and I know the VR clinicals that we now have that conversational AI built in. So the student puts the headset on, they're working with the particular patient and responding, and it's using AI to give the response back. It's very engaging.
And it saves you time because, as someone who ran a simulation center, for me to take that scenario and implement that in a simulation center, I need to pay staff, I got equipment. So it's beautiful when students can take the headset and practice taking care of a patient and, not just practicing skills, they're practicing clinical decision making. And VR clinicals, for example, they're taking care of more than one patient and trying to figure out, how do I prioritize? How do I delegate? Those are all important things that a test is not going to really evaluate.
I love that. And, I have faculty say that they have a particular content to teach and they're just not sure how to present it in an engaging way. So they ask AI, what are some active learning strategies that I could use to be able to bring this to life in my classroom, which is kind of exciting. The other one I wanted to mention too is I've done a lot of research and I've done quite a few presentations on bringing civility back to academia. And one thing that I've seen and kind of coach faculty on too is using AI to be able to navigate some really critical conversations with colleagues, with even their supervisors, maybe it's a dean, director, associate dean, when you see some incivility or maybe lateral violence or some implicit bias. I mean, all those different pieces. And what words do you use in written, but also verbal? How do you try to talk with the individual to which is exhibiting some challenging behaviors? And, AI has given a lot of, here's the email that you might prompt a meeting with them and a conversation in a very not only engaging, but also appreciative way where you're honoring their gifts and their strengths, but also you're not condoning their behavior. You're actually addressing it. I've found that AI is very helpful in navigating some of that.
I like that idea because, me, my simulation mind, I'm like, oh, I can turn that into a scenario. And then on top of that, once you have the scenario, you can embed that into something like ChatGPT and actually turn it into an actual interaction where the phone is playing the role of whatever, the person, and you're using those skills and trying to navigate that difficult conversation. And then in turn, when you're done with that interaction, having it then evaluate you. So
I love it.
yeah,
There it is right there.
the other hot topic I do want to mention that faculty are asking for is, there's this big movement now to competency-based education. And there's a lot of questions on how do you do that? that's another way that we can start using AI to help us build those competency-based curriculums and assessments and figuring out how to scaffold student outcomes across the semester.
I love these examples, of innovation in action. So let's talk about a little bit about the educator's journey. You've got novice nurse educators coming from practice, excellent clinicians, right? But they're new to nursing education, and some seasoned folk that are maybe not as techie savvy. What kind of support or training do faculty need to feel confident in using AI? And is there any resources or strategies that you'd recommend?
Number one, there needs to be support from the top, so leadership needs to, number one, understand the importance of AI and willing to invest the money, resources, and time for their faculty to learn more about AI, whether that's taking an online course. For example, I took one. There was a Harvard AI course in healthcare implementation that was 8 weeks. That was great. But there's a lot of other ones out there, so I'm not promoting any particular one, but supporting faculty to do that. There's some free ones, free MOOCs that are out there in Coursera where you can learn about prompt engineering. I took one of those too. Making sure that people have the opportunity to go to different organizations. So I'm a simulationist, so, Axel's one, SSH, where you can go there for 4 or 5 days and take as many workshops as you can and focus on AI, because there's so many now is the hot topic. There's a lot of presentations on that. So you can learn as much as you can in a short amount of time. And then making sure that you have someone on staff that can help with either doing some professional development courses, holding faculty's hand, and, as they start to use AI, and being supportive and showing them strategies and ways that they can use AI to enhance their teaching. I think that's all important. And a lot of it's self-directed. You have to kind of just go out there and play with it, start using it, talk to others, find out how they're using it. We need to share our success stories with AI so that others can use some of those tips that you learned along the way. So I think all that's important. But we need to have some more structure to be, at NLN, for example, we're creating a AI course for nursing educators, nurse educators. So we need to have more of those type of courses available.
Mm-hmm. Absolutely. And I think of new faculty orientation as they're coming on into their new role. How do we embed it in there, and then ongoing PD? And I know through Lippincott, or Nurse Tim actually, owned by Walters Kluwer, being able to tap into some of the webinars and some of those trainings that team also provides is super helpful. But I think it's being able to lay that foundation. What do we believe at this school? What are the policies? How do we navigate it so that it's consistent for our students, whichever class that they come into, and give faculty that support that they need. So, and I know support and preparation is definitely key. And I'd love to hear your take on this next question. So, how do you see the role of AI evolving in clinical practice? So we know students go to clinical, and then obviously we're transitioning them to practice. What are the implications does that have for how we prepare nursing students today? Are we getting them ready for what they're going to see in practice?
I don't know if we are right now. I think the first step is, because some of us in education, we're not working in the hospital setting. So that's the first disconnect. We haven't been in a hospital setting 10, 20 years. We haven't touched a patient, and I'm one of those guilty. I haven't worked in a hospital. I was there when we had charts, like paper charts.
Me too.
So the first step is, as educators, even if we're practicing or not, we need to know how AI is being used in a hospital setting. So one prime example is ambient scribe. So there's going to be systems where they're going to be listening to interactions of healthcare providers and patients, and the system's going to be extracting the important information and putting that right into the chart, which is great because we know, nurses spend, I think, 20, 30% of their time charting. I would say for the most part, we don't love charting. So to be able to have that available so that we can just go in and check, okay, that looks accurate, add that to the chart, and spend more time with our patients is wonderful. So our students need to see all of those uses in the clinical setting, be familiar with it. So when they graduate, it's not going to be foreign to them. Let them practice using some of those AI software programs. I just read today that Epic is going to be rolling out, I think it was Emmy, Penny, and there was another name. Programs where one of them was for charting, one of them was for coming out with codes and billing and all of that. But it's here, it's coming. So we need to make sure our students know about them and know how to use them. Everything from predicting whether a patient is, high risk of deteriorating from sepsis, to how to use it to plan clinical treatment plans for patients, like someone with cancer, using AI to figure out, what's the best chemo or treatment plan for their cancer. I mean, there's so many ways that it's currently being used. So we just need to make sure that they're aware of it and that we get them that hands-on experience with these tools.
As we close, let's leave our listeners with something to reflect on. So what final spark or pearl of wisdom do you have for our listeners today?
I would say for those that are a little hesitant, a little fearful, not quite ready yet for AI, my first thing would be a statement. AI is here and it's not going anywhere. And my takeaway is there's only one way to get familiar, and that's just jump in and start using it and use it in an innocent way. Maybe just download whatever, whether you're a Copilot, ChatGPT, Perplexity, whatever AI system you want to use, and start using it maybe just for personal things if you're scared to use it for work related. And the more that you play with it, the more you become familiar with it. This is a great tool, and it really can make our lives more efficient, faster, easier. But also, I as much as I want to push the use of it, I also want us to be careful and cautious about it also. But my pearl of wisdom and takeaway is just start using it and ask questions and ask people how they're using it. And the best way to get familiar with it is just to jump in.
Thank you so much, Kellie. I appreciate you sharing your insights and your expertise. And for me, today's conversation really highlighted the promise, but also the complexities of AI in nursing education. And I think it reminds us of the importance of thoughtful integration, being very thoughtful and having that, that continuous learning, because we're all evolving. So thank you again, Kellie.
Well, thank you for inviting me, Kellie. I really enjoyed our time together.
Thank you for joining the Lippincott Spark Illuminating Nursing Education podcast. Enjoy this episode, subscribe, share, and leave us a 5-star review. For more information, click on the link below to learn more about Lippincott Nursing products and services. Until next time, keep leading, learning, and making a difference in nursing education.